Greetings, everyone. Welcome to Macro Social Work Stories. Today we have a guest, and we're going to have him share his story, his lived experience as he journey through social work as a professional. Today we have our guest, Mr. Courtney Hall. Mr. Courtney Hall has a dear place in my heart. He is a colleague, a friend, as well as we have similar interests in our past. And so we're also classmates in undergraduate many years ago. And so we want to thank him for saying yes as we have him share his story. Welcome to Macro Social Work Stories, Mr. Courtney Hall.
Thank you, Gary. I appreciate the invitation and the introduction. So I'm Courtney Hall. I am an MSW, licensed graduate social work. I've been doing this work for, let's call it 19 years, something like that. Let's not count too much. As Gary said, he and I graduated from Oakwood College, now university together. We then went our separate ways. He went to another school. I went to the University of Alabama. And we both landed in the DMV area, the DC, Maryland, and Virginia area. Currently, I am serving as the CEO for Interfaith Works, which is a nonprofit in Montgomery County. At Interfaith Works, we serve about 35,000 people a year across the spectrum of poverty. So regardless of what they are experiencing, it's most likely that we have either done it in the past, we are doing it now, or we have plans to do it in the future. Interfaith Works has three shelters, two of which are the only shelters for women in Montgomery County, Maryland, which is the largest county in the state. We also have a spectrum of affordable supportive housing. We have food distribution, clothing distribution. We do emergency financial assistance. And we also have a vocational services program where we help about 100 plus people get jobs every year.
Yes. Thank you for sharing.
Impressive.
Yes, what you are doing now. Let's take a couple steps back. Let's look at your interests, your entrance into the social work profession. What were some of the things that sparked your attention to become a social work leader?
Yeah. So maybe I'll go back a little bit further and talk about how I landed in social work because it was not intentional. I initially had a desire to be a neurosurgeon. At the time, I had a hero. I won't say who that person is.
He used to be our hero too.
I did have a chance to meet him in my childhood. Was very inspired. Had his book, and was certain that that's what I was going to do. And as you grow up as a kid, I decided, maybe I don't want to be a brain surgeon anymore. I wanted to be a cardiovascular surgeon, still in the medical field. Then I decided, maybe I just want to be a regular doctor. And then as I made my way through high school, realized that perhaps dissecting animals and doing that kind of work wasn't exactly what I wanted to do. So I decided perhaps something dealing with the mind is something I would be interested in. So I decided I wanted to be a psychologist. When I got to Oakwood, that was my intent, to be a psychologist. Then I ran into someone who still is one of my favorite professors today, Dr. Keslin Stannis. Well, at the time, her name was Braid. And she had a mantra, which was that social workers can do anything. And anyone who was at Oakwood during that time can tell you, if you start that phrase, they'll finish it for you because they had a chance to interact with Keslin. So actually, that was my entry into social work. I still, at the time, I was very interested in clinical social work. I came to understand that social work, if you want to help people, through therapy, counseling, that sort of thing, that was a shorter path to get there, and perhaps even it would allow you to have a more diversified experience. So that was my goal. As I got into the latter years of my undergraduate degree, I had a few internships, two of which actually dealt with therapy, one individual therapy and the other with group therapy. And I realized very quickly that that's not at all, actually, what I was interested in. So I had an opportunity to do an internship with Alabama DHR, Department of Human Resources, and that was child welfare.
Mhm,
I actually, in graduate school, I took advantage of a scholarship through the state of Alabama, where
mhm,
social workers, sort of in training, could do their internships with the Alabama Department of Human Resources, and they would receive a stipend, and in exchange for that stipend, they would they would have a commitment of working for Alabama DHR for 2 years. And I was intent that that's all I was going to do. I needed the money. I was a poor graduate student. I needed to pay my rent and eat food. So I needed this stipend. As I finished my internship and got to the end of my 2 year period, I began to realize that I actually do kind of like this work. And as a result, I ended up remaining in child welfare for well over a decade.
mhm,
Work started as a social worker, a child abuse and prevention investigator, then moved up to a supervisor, moved up to county director, which is where I sort of ended my career with Alabama DHR. I then came over to
mhm,
DC and worked with the Child Welfare Agency in DC. I was the deputy director for operations, so that meant everything related to foster care. Starting in my leadership experience in Alabama, I began to realize that maybe I wasn't having this kind of impact on families that I wanted to.
mhm.
There seemed to be a common theme amongst the people we were working with, which was poverty. Now, anyone in child welfare, and I hope it's not too controversial, but anyone in child welfare will tell you that families are never targeted because of their poverty. And I think that's true. I don't necessarily know that there is an intentional, like on the sort of child abuse hotline, that there's an intention to only work with people who are experiencing poverty. But that ends up, for many reasons, including systemic racism, systemic inequities, that ends up being the population of people who are most involved in the child welfare system. And I became very disillusioned and started wondering if I could do more good if I got further upstream. So I left
Mhm.
child welfare and went into the work of housing and homelessness, brought me over to Housing Up, where we did a variety of programs, operated a variety of programs. And then I had the opportunity about a year ago to move over to Interfaith Works as CEO.
Okay. Yes. Extensive history as you looked at your different experiences and having impact. Impact is significant. It's important. Um, when you look as you look at impact and the work that you're doing now, working with families, challenging systems of poverty. Um, what would you say to a emerging social worker who may have, I guess, some of the thoughts of their ability to change something rather fast, and how
Mm.
it's more of a marathon rather than a sprint? How would you share a message of encouragement to aspiring social worker?
Yeah, for sure. It's absolutely a marathon when you're working with people. It really depends on the kind of work that you're doing. From my perspective, and certainly over the last probably decade or so, that I've had the chance to lead teams and lead teams of people, I would say that my focus has really been on the impact of policy and public policy and how that has a direct impact on the
Yeah.
kind of work that you do on a regular basis. And that was actually not a very easy concept for me to understand in the very beginning. It took some
Mhm.
time for me to understand that. But once I understood that, it became easier for me to sort of focus attention on advocating for things that I knew would benefit our clients. So, for example, if you're talking about access to public benefits, if you're talking about the stigma around people
Mhm.
who take advantage or who are able to benefit rather from public benefits.
Mhm.
Um, if you also think about the impact of local policy, so your local policymakers, your local legislators, and the impact that they have on the work that you do every day, once you understand that, it's easier to really focus on where the change should be. So, my advice to any social worker would really be, yes, focus on the people who you're serving, for sure, the families, the individuals, even the communities, but don't forget how important it is that you have policies that match the kind of work that you're trying to do.
That's really incredibly important. Could you talk about? I mean, as you said, as both you and Gary are saying, this is a long haul work. It's a marathon, not a sprint, and that's a lot to do with the legislature. That's got a lot to do with the policy itself, which is getting and keeping people's attention as opposed to other interests. So, um, in your experience, what have you found are the special ingredients or the needed ingredients to have an impact um, on the kind of the housing legislation, food legislation, whatever type of legislation you've been involved in? What are the key elements that leaders of today and tomorrow have to focus on if you're going to be able to hold your own against real estate interests or developer interests or whatever they might be?
Primarily, I'd say the importance of communication and communicating the impact that your work is having on the people who want to be who you're trying to serve. I found that elected officials are very interested in helping people who have, are experiencing poverty or experiencing the most difficult circumstances, but often they don't necessarily know what to do. So they look to people like me or like you, other leaders in our field who have experience with that. What I find though is that sometimes social workers lead with stories uh, about the heart, right? Which is very helpful. If you're going to make an impact, if you're going to get someone interested in the
Yeah,
work that
yeah.
you're doing, you really do have to communicate why it's important, and sometimes, often, sort of tugging on the heartstrings of the person that you are speaking to is very effective. I found, however, that equally effective, and in some cases, depending on the audience, even more effective, is data. And
Oh
being
yeah.
able to communicate, for example, in Montgomery County, the the average wage, if you're going to live without government assistance, is $91,000 for a household of four.
Yep. That's going
Equating
on.
that then to the average cost of rent of a two-bedroom apartment and the minimum wage. In Montgomery County, the minimum wage is $15 an hour, which is higher than some of the other jurisdictions. But if you think about the average cost of a two-bedroom apartment for a family of four, that parent would essentially have to work three full-time jobs in order to just afford, which is impossible. I mean, you have
Yeah,
people who are warriors and
yeah.
you're doing, one and a half jobs or maybe two jobs. You're really doing some, our hats off are off to you, but three full-time jobs. And so when you communicate data in that way and then add in the story of the person who someone who you've had the privilege of serving, those two things together, I find, make a significant impact and really capture the attention of our elected officials.
Well, that's powerful. Our previous speaker last week talked about the value of data too,
Data,
from a
yes.
slightly different angle, but together you're both having an incredible impact on the people paying attention to this. Because, of course, one of the things you're suggesting is that social work schools need to do a little bit more prep on how social workers can handle data. Because, um, I don't think a lot of schools do. And if we're going to do macro work, whether you're a clinician or whether you're, CO or leadership management, data's got to be there. And
Right.
yet people are afraid of it.
Yeah, yeah. Because data tells a story. Data being able to paint a picture so that our key stakeholders, our politicians, our community members can see where we want to go and where we are now in that process. Can you share some of your, I guess, success stories as it relates to um, utilizing data to partner with clients to tell them about their different options, how data is used to like look at outcomes for different services that are provided, for housing that you provide, housing or food insecurity for the population that you work with.
Sure. So one of the ways that we are using data to communicate impact um, through interfaith at Interfaith Works anyway, is focusing on. So we, as I mentioned, we have food distribution and clothing distribution. So we are able to quantify the amount of clothing that someone receives when they have an opportunity to shop with us a couple of times a year. And so we're able to then say to elected officials, we distribute through the clothing center $2.5 million worth of clothing. We give it to
Wow.
people for free. Okay,
Wow.
that's a direct economic impact that people can understand. You then break that down further and say we serve about 6,000 families a year. So then now you're quantifying numbers and you're saying each family, because of the services that we're providing, is able to save, thousands of dollars a year that they can then use on some of the other basic needs, like paying their rent, paying their power, um, being able to treat their child to an ice cream cone because they got good grades, things like that. And I think when you do that, then you are communicating the impact of the work that you do. And that, as you said, Steve, and you've also echoed, Gary, can be a foreign concept sometimes for social workers or for people who are in human services in general. But in fact, those are the kinds of things that you really need if you're going to be able to talk to people about the importance of your work. As it relates to clients, I think at Interfaith Works, we try to help people understand how much we are able to accomplish on their behalf, how much support there is in the community. And I think data helps in that regard as well.
Okay.
Have you noticed, I'm sure you have, since the pandemic, um, with the rent increases now that are happening with the inflation, how much more stress do you find the communities that you work with in terms of economic issues, housing issues, compared to say 2-3 years ago?
Significantly more stressed. Absolutely. The number of people served just through Interfaith Works has doubled. So from 17,000 to 35,000 people.
Wow.
Directly as a result of the pandemic.
Mm.
Directly as a result of the pandemic.
Wow.
And so you then think about not only the fact that there are so many people who are living on the edge of poverty and who are now firmly, unfortunately, experiencing poverty, people who were working, who have been unable to get back to work, people who we realize, even we meaning people who were familiar with the work, realized there was much more need than we thought there was. It has all inspired us to really, sort of heads down and figure out how else we can help people in the community because the need is clearly there. But there has been significantly more stress, I would say, over the last 2 to 3 years,
Wow.
over the last 2 years than perhaps we had any idea there was.
So you mentioned your numbers went from 17 to 35,000. Did Did they double your budget?
Well, let's move on to another topic, Steve. Well, in all seriousness, though, one of the lessons learned as a result of the pandemic is that as a nonprofit organization is a business. And this is another message I've been communicating and has been well received from our elected officials. The only difference between a nonprofit and a for-profit business is the tax status. That's all.
Mm-hmm.
Nonprofits still have to remain in the black. We still have to be able to make payroll. We still need operational support. So and in some ways, I think prior to the pandemic, some of these ideas were a little bit foreign, but have become much clearer now for many involved. And that I'm talking officials at the federal, state, and local level.
I've been an executive coach to a lot of nonprofit executives and public sector ones for years. And one of the issues that you've struggled with for so long is budget shortfalls caused by your funders just not getting you the money on time. I have a story of one nonprofit had a $3 million contract awarded in July. They got the funding in June. And whenever I tell that story, people go, no, you mean they got the funding in June. I go, no, they got it in July and got
A
it in
year later.
June. I mean,
Mhm.
so the struggle to be able to, like you said, to meet payroll, to be able to handle your vendors, um, is a kind of pressure point on executives in the nonprofit sector that doesn't get a lot of attention. It's sort of like it's there, and yet people aren't aware of the cost that it puts on the executives and eventually on the frontline staff as well.
Right. So, and not only that, Steve, but pressures around pay. So
Yeah.
the Great Resignation has been knocking on our door as well. Knocks on
Mhm.
the door of nonprofits all over the country, certainly the state of Maryland, but definitely
Mhm.
all over the country. We are businesses. And so all of these stories that you hear about in the news, struggles that businesses are having, finding good qualified people to do the work, being able to remain competitive with pay, those are all struggles that we have as well. Every one of us. And so you're absolutely right. There is, I think, there is an increased acknowledgement that nonprofits are businesses too.
Yeah.
Yeah.
Yep.
Yeah. So as you look at the nonprofit space, and our training that we receive in undergrad and graduate school, um, what were some curriculum guidelines that you would suggest for our higher educational systems? Because we know that because of the pandemic, we cannot complete social work how we done it 20 years ago. Many of our classes using the same textbooks that we used when we were undergrad, without um, innovative initiatives on how to actually bring about transformational change. Because I remember as a child, my mother was a case aide. My sister, 20 years later, worked with the same parents.
Wow.
Mm,
Wow.
And so, what are we really doing? And
mm.
so, any suggestions on how we could really bring about change where some programs we can work ourselves out of a job
Yeah.
rather
That
than,
I love that
yeah.
that phrase, Gary, working ourselves out. I would love, so Interfaith Works turned 50 this year.
Mhm.
So throughout the entire year, we're celebrating 50 years of service. But I also say that with some chagrin, right? Like, why have we been around for 50 years working on the same problem? And it's not to
Yeah.
say that the work that we're doing is not effective. We are helping people. We are
Mhm.
absolutely helping people. We've helped thousands, tens, hundreds of thousands, rather, of families over the last half century. What we're really talking about goes back to an early part of our conversation, the effective policy.
Yeah.
We really need, I think, in social work to have more of a greater focus on the impact of legislation and the realization that as a social worker, you absolutely have an ability to move legislation forward. You absolutely do, through advocacy, through education of the elected officials. You could even go so far as holding candidate forums to for elect. I mean, it's election season now, right? So many of the people who are running for office, they want to be seen, they want to have support. And while as a social worker, especially if you're in the nonprofit space, you may not endorse a particular candidate, but you certainly can make sure that they're aware of and educated on your issues. One of the
Mhm.
things I said earlier is that often I find that elected officials want to make change, but they don't often know what to do. And I find that if as social workers, we can help them to understand what they should be focused on and perhaps even give some suggestions about how they can move some of those things forward, they can take it from there. They've got staff, who have, legislative staff who have lots of years of experience and can put draft some of these policy, legislative um, ideas, put them into actual legislation. And then you can, as a social worker, help to rally community support, convene conversations about important topics, have that elected official there. They're going to like that. They like to shine too. And
Mhm.
then all of a sudden, you have support in the city council and the county council at the state legislature for the things that you've been advocating for.
Yes.
No, that's really. I really hope we'll make sure that your words get heard by a lot of people in the Council of Social Work Education, because a lot of schools unendingly focus on implicitly focus on licensing, and out of that the idea, even though we all know it never happens, but the idea that everybody's going to become a private practitioner.
Yeah,
And by doing that, by selling this kind of wolf ticket about one thing, but then actually not making it available to people, we're not paying attention in the way we need to what you're talking about. Um, I do think the one thing I'm thinking about with legislation, the other part that comes up, given what you're doing, is you also end up in the real estate business, if not the business. But without housing development, um, and without, and I'm sure you know the data on this, they talk about affordable housing. Well, in New York, when they're talking affordable housing, we're going to build it for everybody who's means tested to meet our criteria. And lo and behold, your number, they for affordable, they're talking about family income of $90,000.
right.
Well, what about the family making 40 or 30? So um, housing seems like a huge issue for the next 10 years in order
I
to
would
really deal
say
with poverty.
certainly, I would say beyond the next 10 years. Absolutely. So before Interfaith Works, I worked for an organization in DC called Housing Up. And Housing Up has a very unique approach to this work because they are a housing developer. So they're a nonprofit housing developer, meaning that they rehab,
Yeah, yeah.
build housing in some instances, and also they offered offer supportive services to the families who are living in that housing. That, you know, one of the things that we were very proud of while I was there is the long lengths of housing stability. So you take people who had experienced homelessness, perhaps had even been bouncing from shelter to shelter, couch to couch, and now they're in an affordable housing program paired with supportive services, and now they've been housed for a decade. You know, that now we're talking about a decrease of trauma in that family,
Yeah,
because no
yeah,
longer do they have to worry about where they're going to lay their head at night. They can actually get their minds wrapped around some of these other things that they probably want to accomplish, like starting a career, going back to school if that's in the cards for them, making sure that their children get the proper sorts of support in school so that they can be successful as well. But absolutely, housing, I would say, is a sort of key thing. And, um, I'll say two things: homelessness is a policy choice, and poverty is a policy choice.
Mhm.
yeah,
Right.
absolutely.
Yeah.
And so, yeah.
That's
Uh, uh,
Yeah.
that's a great story. I mean, again, and banks have to be open to providing the same capital for a nonprofit housing developer as they do for the others, and that one is a longer term issue as well. But you raised something really interesting. How do you that made me think of something else, which is what about the educational needs of the families you're with? I'm working with it's a different hat I wear. I work with a online school that really provides very good supportive AA training for people that enter the healthcare field. And we draw upon the population we work with are all people who've been poor, who are now overwhelmingly black and brown people, somewhere usually mothers between the age of 24 and 44, who finally got their GED but now need a way forward. So, do you find um, how do you find getting? We have this great resignation thing going on, but are you or are you able to provide alternatives for people to be able to get that educational leg up to get that economic leg up afterwards? In other words, can you get them? Is there a pipeline into programs for them um, for the educational needs that they might have?
well, I'll say this, Steve. You must be reading my mail. This is actually something that we have
Mm.
recently become very interested in. It's something called a paid apprenticeship. So, what we often find through our vocational services program is that Many of the, so let me first say, I'm extremely proud of our program. Pre-pandemic, the placement rate, job placement rate was 78%, which for the population we're dealing with,
Yeah, yeah.
I've been doing this work for many years, is extremely high. That dropped
Mhm.
by about 15 to 20% during the pandemic, which I think we would have all expected, even though the
Mhm.
number of people we were serving grew because there were many more unemployed people. What we found, though, over the years is that many of the jobs that we're able to help our clients secure are entry level and still relatively low wage jobs. So I mentioned
Mhm.
earlier that the minimum wage in Montgomery County is $15 an hour. So if we're able to get someone, and often we do, 16, 17, $18 an hour jobs, it's great. We're very, very happy about that.
Yeah,
But
yeah.
if you think about what it takes to live in Montgomery County, that's still a low wage job. It's a poverty wage job. So we've been
Mhm.
thinking, to your point, Steve, about figuring out a way to create a pipeline to higher wage jobs, 25, $30 an hour jobs. And we're talking construction, we're talking green energy, we're talking biotech, we're talking IT. All of these jobs where you can walk in at an entry level and start making, uh, good money.
Yeah,
What we
yeah.
found, though, is that those programs require training. They may not require a 2 year degree, and often they
Mhm.
don't, but they do require, 6 week, 3 month, 6 month training courses. And often because our clients are in such dire straits, because
After
they're
work.
thinking, I have to be able to feed my family
Mhm.
tomorrow,
Yeah, yeah.
Right
Right.
now. Right
I
now.
can't wait.
the idea of waiting 6 months,
Mhm.
because I'll be able to graduate into a higher wage job. It's just not feasible. So the paid apprenticeship model, meaning that you come through a program, we help to prepare you, you get into an apprenticeship, you're working with a specific industry or a specific company, and after 3, 6 months, you walk into a job making their minimum wage, which in this case we're targeting 25, $30 an hour.
Yeah,
So that's a
wow.
model that we're exploring, trying to figure out exactly how to make that work, how to make the funding model work.
Mhm.
But I'm really, really excited about doing something like that.
Yeah.
Van Jones did some of that out in Oakland. Look up what he did. He did it before he became Van Jones of the world. This is what he did, and it's really impressive. They did. It was around exactly a very similar model to what you're talking about, where it was about green jobs. So, and I can't remember the name of the program, but if you put Van Jones Oakland, job program, it'll come up. I'll try to find it as well. I have it somewhere. I'll send
Yeah.
it.
I like how you talk to focus on livable wages. Many times we talked about the work that we do, but if our clientele, our communities we work with, don't have livable wages, they really cannot obtain sustainable housing because we know that housing goes up there with quality of life, your environment, how you feel about yourself, which impacts your health. All these different things are interrelated in that process. So as we wrap things up on today, I you highlighted a number of things and how policy really drives the work that we do, and one has to have data to tell the story. And so we thank you for highlighting how data has been utilized to partner with key stakeholders, have been utilized to uh, measure outcomes of the work that you do uh, on a regular basis. So as we want to give you the last note, your last words as our guest. Can you share some what you want to challenge our society with? Um, Seasoned social workers, emergency social workers, anything you want to challenge them with to go forward.
Focus on policy. Remember that many of the social ills that we deal with every day in our work are driven by policy choices, whether it's the political will to do or to not do something. So do not forget the impact of policy. And social work schools figure out a way to make sure that students are being exposed often and early to policy, and not just in some sort of like a passing, bonus course that you can take, right? Like I'm talking a real concentration, deep dive into policy and how it affects the work we do, so that students are exiting school, master's level programs, understanding that this indeed is the kind of work that has to be done even by clinical social workers.
Mhm.
Beautiful.
Yes.
Thank you
Thank
so
you
much.
for
That was great.
Yes, thank you for the work that you're doing and the difference that you and your team members are making. I know that we started off, I was a higher um position, but now I look up to you. The work that you're doing, I'm thankful that I can say that I know Mr. Courtney Hall and can see the impact, transformation impact he's making in communities in our nation. Thank you for being on our podcast on today, Macro Social Work Stories, and we'll see you in our next video. Thank you.